And we've been hearing in the news that there is quite a backlog at some of our testing facilities. So at what point should one get tested?
Okay, so that's a very interesting question, and I want to take a step back here. So we need to understand what are we actually testing for? Why are we testing for this virus? Because as you know, the flu or a normal cold, you wouldn't go out and test if you got that virus. So the reason we're actually testing for this virus is that because it's a significant epidemic and pandemic, and it can make other people sick. So we actually that's the reason why we're testing. Now, what are we actually testing for? As we know in laboratory tests, when you have certain diseases that are caused by various pathogens, you can either test for the virus or the antibodies. So what we're actually testing for when you go for a test is actually the virus, the coronavirus that causes COVID-19. And how they test for the virus is they take either a nasal swab or a throat swab. They then send it to the laboratory, and the laboratory will go through their processes and they see if they can identify that virus. Now, that virus will only be able to be picked up within 3 to 5 days of having been infected with the virus. So, in other words, if you were infected by the virus today and we went for our throat swab today or tomorrow, it may show negative. It may not come up. You have to wait for a period of 3 to 5 days until that will actually show up that you're actually positive for the virus. Once you've got that and you know that you're positive, and the reason that you want to test is that there are 2 reasons. One, yourself, you want to go into isolation. We'll talk about that, isolation or quarantine, and so that you don't infect other individuals. And that's going forward. But also you want to maybe, and not maybe, but you should inform all those people that you were in touch with or that you came into contact with over the last week to 2 weeks, to let them know that you are now COVID-19 and they should watch out for symptoms. And if they develop symptoms, they should look to be tested. That is actually the broad protocol. However, we do know now that the laboratories are becoming quite overloaded. And we've actually seen this in other countries around the world. And now we see in the South African environment, either in the government or the private laboratories, there are huge backlogs and they're struggling with the number of tests that they are doing on a daily basis. And what the laboratories have said, that you should only go and get tested if you are a person of risk. And by person of risk, I ran through those comorbidities. Or if you are over the age of 60 and being in contact with someone who's COVID positive, or if you're developing symptoms, significant symptoms that would alert you to being tested. But if you're just an individual who's come into contact with someone who's COVID positive, you're not high risk, you're not at the age category that should be tested, you haven't developed symptoms, then you should go into self-isolation for a period of 14 days.
And I've heard some horror stories about the testing process. I've heard that it is quite uncomfortable. Some people say it's painful. Is this true? Can you take us through what to expect if somebody is to go and get tested?
I can't vouch for it because I haven't gone to the test myself. However, I can go in terms of what I've seen, how they do test, and I've seen what people experience. So it is quite uncomfortable, but it's uncomfortable for a 10-second period. You know, when you go for that blood test and they put the prick into your hand and it's just for that moment that you feel it going into your vein, that sense of uncomfortableness, it's quick and it's over. So the same thing, they put the swab into your nose, down your nasal cavity, onto your throat. For a short period of time, it is uncomfortable, but then it's over and you're not going to feel any long-term side effects for having that test. So before you know, it's basically done and over. And then within, as I said, within a 24 to 48 hour period, ideally you should get the result, but now we know that there's a backlog in the labs and you're probably going to have to wait 3 to 5 days to get your result.
And now we've also experienced the screening posts at most of our supermarkets and shopping malls where you have to sanitize your hands. They check if you're wearing a mask. They check your temperature. Is this all necessary? And is it enough to stop the spread of COVID-19?
Great question, and this is probably an area that I probably want to emphasize the most. And if there's any take-home point out of our discussion, it should be this. The responsibility to prevent the spread of coronavirus and for the individual not to get infected with the virus now rests with the individual. We know in the early days in the SA government, they had the lockdown, etc. They've relaxed the lockdown, and now it rests with the individual. And there are three primary methodologies for an individual to significantly decrease the risk of them getting the infection and also passing it on to others. And those are wearing a mask. So whenever you're out in the public domain, out of your house, you should wear a mask. The second thing is hand washing, hand sanitizing. You should continually be doing that and washing and cleaning your hands. And thirdly is social distancing, and making sure that you're always 1.5 to 2 meters a distance away from any individual you're interacting with. Those three methodologies, mask wearing, hand washing and sanitizing, and social distancing. If everyone did that in the country, it would significantly bring down the risk of viral spread through the population and would bring down our numbers of those getting infected. And that is why they're so strict at the various offices that one is going to, and public spaces and shopping centers and wherever you go, that we are wearing our masks and we're washing our hands, and we should try and keep those distances. The reason they do those additional screenings, for example, temperature or have you experienced symptoms, is that if you perhaps are now COVID-19 positive, you've tested positive, or you don't know that you're positive and you've experienced any symptoms or you're showing a temperature, then they'll avoid you or prevent you from going into those areas just because there could be a risk that you actually are infected with the virus, and they prefer you to stay in a private space until that is cleared.